Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, May 5th, providing you the update on the coronavirus from Albany Med. In the 5 counties, we now have 2,767 people who have tested positive for COVID-19. Inside here in the medical center, we currently have 57 patients. We have 39 on the floor, 18 in the ICU, and 6 on ventilators. When we look at the county numbers, Fred, that's about a 5% growth. I think we sometimes see numbers a little bit higher, a little bit lower.
Yes. We've been 1% and we've been 6 or 7%. It does vary from day to day, but there's no substantial difference.
And inside the hospital here, 57 is about where we've been.
So on April 22nd, we were at 57. So we've been at 57 plus or minus a couple for a couple of weeks now.
And 5 seems to be the number today, because today is May 5th, and we have 555 people in the hospital. To remind everybody, we can have as many as 750 on a busy day.
That's right.
So the 57 COVID-19 patients is just a little bit more than 10% of the population in the hospital.
And we're about 200 patients under what our typical volume would be on a Tuesday.
Which gets to the next topic, which is the hospital is normally a little bit busier than this when we're doing the medically necessary procedures that we've done in the past. I know we've submitted our waiver. Is there any update?
So we submitted a waiver on Friday. We got a response back requesting some additional information Sunday night, late Sunday night. We responded yesterday. We provided that additional information. It was received. We were told that it was now complete, and we're waiting for their recommendation. So hopefully today, Dennis will hear.
Fred, one of the very important roles that you've served here, many roles, was you ran the faculty practice for almost a decade.
Yes.
I ran it for a much shorter period of time, but we both run it. We know how important the faculty practice is. Recently, the faculty practice leadership reached out to the people we serve to say, what's going on with all of you?
That's right, Dennis. We actually sent out a survey to over 60,000 patients that are routine patients in the faculty practice, basically asking them about things that are important to them in terms of coming back to receive care they need. What would make them feel comfortable, safe in our practice sites. So we're waiting for those results, hopefully very soon.
And while we're waiting for those results, let's talk directly about the safety measures we've put into place in our practice location so that when people come in, it's an environment as safe as it could be, similar to what we've done in the hospital.
Yes.
Let's begin by when you call for an appointment with the practice, you're screened over the phone. You're asked about travel history. You're asked about symptoms. If, in fact, you have things that make it sound as though you could potentially have COVID-19, if you don't need to come to the hospital, then you're set up preferentially for a telephone or video visit. If, in fact, you actually come in for a clinic appointment, when you arrive, you're screened for your temperature. And if you have a fever or any other symptoms that are concerning, you're immediately put into a room by yourself, and staff will take care of you wearing the proper equipment. Visitors are limited to only those that are essential, and even the visitors are screened for temperatures as well. Vendors who often bring supplies into the clinics are only on a very narrow basis allowed to come in as well. All of our staff who work in the clinics are trained on the proper wearing of the PPE, and we have adequate supplies. And I think there's a couple other things we've done as well.
And so the staff and the patients wear masks. So we're using that both in both groups as patients are being taken care of in the facility. And we're working on putting up barriers, plexiglass barriers at the check-in, check-out stations, which will take a little bit of time. We have a lot of practice sites to work through, but those are also going up. And then the waiting rooms themselves have been changed. So we've created social distancing. We've taken out some of the chairs so that people, when they sit in the waiting rooms, can be at least 6 feet apart, so they're not too close to each other.
So the message really is to a couple different audiences. First of all, to the practice leadership and to those who help set up those clinic sites like facilities. We thank you for creating what really is an incredibly safe environment for patients to come in. To the patients who come into the practice, we want you to know that the site is safe, and we continue to put measures in place to be safe. And to the folks who are working in those clinics, we thank you as well for the care of all the population that's out there. And one of the groups that cares for patients in the clinic is nursing. And we talked about nursing, and we've talked about nursing, this being Nursing Recognition Week at Albany Med. And we are pleased to announce that the first two Pillars awardees last night were recognized. They're both emergency room nurses who I happen to have the great pleasure to work with. Lisa Sutton and Jen Hamlet. Congratulations to both of you. And I think, Fred, there's going to be a couple others this week that we're going to highlight as well.
Yes, there are going to be some more. Normally what we would do, Dennis, is we would have a big ceremony. We get a lot of people in a room, in one of our large conference rooms, and we would recognize nurses that have been nominated by their peers as pillars of nursing here at Albany Medical Center. Now, unfortunately, we couldn't follow that tradition this year because of COVID. And so we're doing this location by location, nurse by nurse, with a relatively small number of people.
Right.
But it doesn't diminish the importance of these awards. These are the creme de la creme of our nursing, and we congratulate them all.
We do, and as we name the others this week, we'll certainly bring those names back here and show you their pictures as well. Finally, I'm wearing a shirt today from the Department of Psychiatry. Robin Tassinari is a psychiatrist in our department. Robin has worked here for 49 years. In fact, he's one of the first physicians that we set up to work remotely, and he's been working from home during the COVID-19 pandemic.
Yes.
But he recently wrote an article, which is on our intranet page, where he talks about the importance of perspective during these times. And he said that this can be a very anxiety-provoking time for many people. And it's important for people to remember that and to keep that in context and not blame themselves for feeling anxious, but to ask themselves what they can do to deal with it. And it's a really important message.
It is. If you're feeling anxious, reach out. There are resources available here in the medical center to help you. Don't bottle it up. Don't keep it in. Deal with it.
And it is National Mental Health Month as well. So not only do we thank Robin, but we thank all the members of our mental health team, which includes our physicians, psychiatrists, psychologists, nurses, mental health aides, everybody who cares, both on the inpatient and outpatient side. Thank you for everything you're doing. So that'll do it for today.
Yes.
We'll be back again tomorrow. We look forward to bringing back some more names of nurses who have been recognized for their great work as pillars of our workforce. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.